I'll be doing my IV piggyback validation. First, we're going to start off with our 7 steps. Wash hands, organize the equipment, introduce ourselves, identify the patient, provide privacy, explain the procedure, and check the physician's order. Then we'll check for, we'll know our 6 rights, and it's right patient, dose, route, reason, time, and medicine. Then we're going to have all of our equipment here. We have our regular IV bag, the sodium. We have our medicine. We have our primary tubing and our secondary tubing, alcohol swabs, a label for the regular IV, and labels for all the tubing. We're then going to open up the regular IV solution. We're going to check the expiration date. Then we're going to use the label and write down the correct solution and the time. Then we're going to discard the garbage. Then we're going to open up the primary tubing. You want to be careful when you're opening up the primary tubing because none of the tubing should go below your waist or obviously touch the floor. You want to move the clamp all the way to the top because it would normally be on the bottom, so that way when you go to set your drip rate, that it's in a more convenient space for you. And make sure that the clamp is all the way down. You're then going to spike the bag. When spiking the bag, you just want to be careful because this is now sterile. So when placing it in, be sure not to touch anything. From the back, then we're going to turn the bag upside down. And we're going to hang it. Okay, then we're going to squeeze this so it's halfway. And make sure that's set like that. Then we're going to prime the tubing to make sure that there's no air bubbles in the tubing.
Does that make sense? If you think of it logically, yeah, it's easier to say.
Place the cap up on the table. So you want to make sure that the end of this, because it's sterile, isn't touching anything and doesn't hit.
I'll give you like a little something. So stand nice. Are you guys going? What? We're trying to. Okay. Can I have my towel? I need a little bubble. So we're gonna let that out.
Okay. Now there's no bubbles in the tubing. So then we're going to attach the tubing to the patient. You want to then take an alcohol swab, clean this thoroughly, as well. Discard of the garbage.
My equipment today will be the regular IV bag, IV tubing, secondary tubing.
And then it's correctly attached to the patient. We have this space in here just because we don't want any leakage. On a real person, we wouldn't need that though. Okay. Now we're going to set the drip rate. To set the drip rate, we're going to take our watch. It's going to be 60 drops per minute. And I'll start on 15.
And I get the primary bag, open it, making sure you keep it sterile, and primary tubing. Making sure nothing touches the floor, keeping everything sterile. I will then open the bag and straighten the bag. First, I'm going to make sure everything is clamped, so that way nothing will drip.
Okay, and it's set at 15 drops. 15 drops per 15 seconds. Also, before you were to attach this, you always want to check the site for phlebitis and infiltration. Phlebitis, you'll see redness, and infiltration, you'll feel cool to the touch. That will be before you would have attached that. Once everything is attached, then we're going to label the tubing with the correct date, and tubing should be changed every 72 hours in most hospitals, but you want to check with your facility and just to make sure that they don't have different requirements.
No, this isn't great.
Okay, now we're going to start our piggyback validation. First, we're going to check the physician's order, make sure you have the right medicine, all your 6 rights again as well. Definitely check the expiration date. If the medicine has a very long drip rate, which most likely it'll be done within the day, but if not, you're going to be labeling it so that way they know when the medicine was placed on. Then you're going to open up your secondary tubing. And okay, and then I'm going to open up the tubing the same way. You don't want to let this fall below your waist or touch anything so it doesn't get contaminated because it's sterile. Then you're going to spike the medicine bag. Spike the bag. And then we're going to make sure nothing's touching. And we're going to lower the other bag. For gravity, you want this to be lowered so that way then we're going to squeeze this halfway. So it's about halfway. And then we're going to also prime this tubing as well. There's a lot of bubbles in this. We want to do this a little bit slower. This clamp is already down because this is medicine and we don't want to waste it. So we're going to open this. Okay. So place that up. Then we're going to prime this tubing very slowly. Open it slowly as you can to not waste any medicine. Okay. Oh, there we go. Now there's no air bubbles in the tubing. Then I'm going to attach it to the primary tubing without touching anything. We also want to clean both to maintain a sterile.
Just be there at 8:15 in the main lobby.
Then we're going to attach it.
Okay.
Okay, make sure it's completely attached. And now we're going to set our drip rate for the medicine as well. First, we want to clamp this all the way down and then open this all the way up.
Is it included?
That way it's not dripping yet. Then we're going to set the drip rate still from the primary tubing. And we're going to do 60 drops a minute. The same just to make it easier for visual.
Only with Sandy, and it was only a couple of times that everything should be. So, I will look at it and I will put it on Moodle. I'll let you know. Let me have a look and see what the story is. Because next week is a validation on Wednesday as well, correct?
There we go. Now it's set.
That is probably when I will be making up Thursday's lecture.
See it drip for 15 seconds.
Wednesday. So at 10 o'clock,
Okay. And that's it. Keep the primary tubing out of the way of the patient so they're not laying on it.
have to come in now at 10.
And then your secondary bag is, your piggyback is all set.
But let me look at the test.
We're going to label the tubing as well, just to make sure everybody knows when it was put on.